A drug to slow the early symptoms of early-stage Alzheimer's was approved in Canada last fall, but for most patients, it is out of reach. Lecanemab is one of the first drugs to show slow cognitive decline in early stages Alzheimer's by clearing amyloid from the brain. And Canada was the last G7 nation to approve this drug. That happened in October. So why at a time when dementia cases are rising rapidly, is this treatment still so hard to receive? For a look at why access is limited, I'm joined by Dr. Saskia Sivananthan. She is a neuroscientist, data scientist, founder, and CEO of the Brainwell Institute. Good morning.
Good morning.
So far in Canada, a Toronto woman and a Montreal woman are among the first in this country to receive the IV infusion of lecanemab. What can you tell us about the drug's effectiveness and a little bit more about how it works?
Yeah, so this drug is specifically for early stage Alzheimer's disease because there are over 100 different types of dementias, Alzheimer's disease being the most common. And one of the underlying pathologies, the thing that's found in the brains of people who are living with Alzheimer's that we believe is what causes that cognitive decline, the memory loss that happens over time, is a clumping of a protein called amyloid beta. And so it clumps in the brain and it prevents the neurons or the brain cells from talking to each other. And what lecanemab does, Leqembi is the brand name, is it removes that clumping of protein, and it's believed to then slow down the cognitive decline or the memory loss that's seen in people living with Alzheimer's disease. The effectiveness is a bit varied in that it's the first class of drugs, and so it slows cognitive decline by about 6 months to a year.
Canada right now has more than 700,000 people who live with Alzheimer's and dementia. Approximately 4 people have received lecanemab since October's approval. So why is the drug so difficult to access?
Well, one of the big reasons has been a lack of a coordinated health system or pathway when it comes to dementia. So it takes about 2 years on average to even get a diagnosis. And with Alzheimer's disease and being able to access this drug in particular, you have to be diagnosed very early stage Alzheimer's or mild cognitive impairment, which occurs even prior to that. But the other reason why it's been very hard to access this drug is that it requires IV infusion. So this is not a pill. You have to go into a specific site to get an IV infusion of the drug. And you need to be monitored very closely via brain imaging because there are some significant side effects related to it. And the third reason I'd say is that we have not coordinated our system to be able to support people from diagnosis all the way as they transition through the different stages of Alzheimer's, because people live on average 8 to 10 years with this disease. That's a long time, and they go through different stages where they need to access different treatments and supports. And those are not in place for dementia the way we have for other major conditions like stroke or cancer.
Is cost one of the biggest barriers? Because there's no official price tag on it, but some reports say it could be around $32,000 a year for Canadians. I mean, obviously that's cost prohibitive, but you make a really good point when you say the cost of keeping Alzheimer's patients right now in hospitals, because physicians can't send them home because they aren't able to care for themselves at home, is also astronomically high. So what is the solution here in order to be able to access this drug for people who just can't afford to pay $32,000 a year?
Yeah, the cost is quite high, and we still don't even know what the price tag will be in Canada because it's only just received Health Canada approval. But the other piece to the cost is that, is it going to be covered by provinces? Is there going to be public coverage of it? And there's additional costs in terms of the IV infusion and the monitoring that's required. You've got to also remember that with Alzheimer's disease, because this drug is only going to be available right at the early stages, and if you slow down that cognitive decline, that memory loss by 6 months to a year, you're still talking about another 8-year window, possibly, when the person is still going to continue to decline. And exactly as you said, are going to require more supports. And this has been the big piece around the lack of pathway and coordination, access to other therapies and supports, because what you need is going to change over time. At the beginning, a person living with Alzheimer's can manage their care quite well. But as that decline happens over time, they need full-time care. And the cost to caregivers who are stepping away from their jobs to also be able to provide that informal care is huge.
It sounds like, doctor, that we need to have another conversation about what is happening with our Alzheimer's and dementia care for patients in this country and what that looks like. Thanks for joining us this morning on lecanemab. Appreciate it.
It's my pleasure. Thanks for having me.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.